Flu vaccine, I think generally we start by November. We have already approved, we have already done technical feasibility and price projections, and everything has been done, finalized, and we have Vigilance's approval to go ahead and procure flu vaccine for general population in anticipation of the second wave of COVID. So there is now a growing evidence, or whatever you want to call it, saying that if we do give flu vaccine, that might protect population from second wave of COVID-19 cell. All the administrative things have been completed. We are already had discussion with UNICEF. UNICEF will be as always, UNICEF will be procuring the flu vaccine for us, in terms of they will facilitate the procurement. So everything is on track, and hopefully by the next flu season we should be able to provide flu vaccine to our population to at least reduce hospital visitations. Since last year, we started introducing flu vaccine for high-risk group. So elderly, children under 2 years, comorbidity, people already with existing comorbidities, and pregnant mothers. We have partial support from the CDC, so we have that already in that. Now the general, what you call a healthy cohort, and Afina health worker. So there are 5 groups that are already getting flu vaccine. So leaving that aside, that package aside, now when we introduce for general population, we cannot reach the whole of the general population, because flu vaccine is a vaccine that it's a time bound vaccine. So it is not like you give, you have to give at least within 1 month period. So it's an intensive reach, so we can't reach the whole of the population. So we are hoping that with the 5 risk group covered already, Himalaya, now this program will probably cover 65% of the population. Coverage. So and then I think, leaving that aside, this alone will cost around 120 million, and that is including, of course, not just the vaccine itself but the consumables. So when you're talking about consumables, the needles and all this, syringes and all. So I think we are looking at 120 million plus at the moment. So 100% achievement, because some will be leave, some will not come to the health facility, because it has to be given in the health facility. So generally, the priority groups is Nadi. We are achieving almost 85% in these 5 groups. So our health worker, pregnant mother, children under 5, people with comorbidities, and 65 years and above. So only 5 groups, Nadi, we have almost 85% coverage. So for now, I think there is a literature that says if you do actually give flu vaccine, there's actually hospital visitation is reduced. Yes. So people with respiratory illnesses, it comes down, because generally if you're prone to flu, then you have more hospital visitation. Yes. So those can come down, and then the comorbidity itself. Because if you already you have flu and then you also have coronavirus, then this is like the double burden. So if you do literature search, they're saying many countries are now opting to vaccinate, make flu vaccine available, readily available to the population.